just for purposes, I'm just going to set a timer so that we know that we're going to be doing 20 seconds of hand washing. So when you start the timer, you turn on the sink, use your wrist, get soap. 1, 2, 3. Then I do 1, 2, 3. Clean between the fingernails, clean behind, wrist, fingers, hand washing. So the important thing is to get the palms, the back of the hands, the fingernails, the thumbs, and the wrist. And then turn off the sink and then dry. And that should be plenty of time, 40 seconds. So in terms of the masks that we have the pediatric mask, we have a cloth mask, which could actually be made out of fabric. We have the surgical mask, which has a face shield, or you would just wear the surgical mask by itself. And then we have the N95s that are fitted for patients. Some N95s also have respirators on the side. So some business owners, if they're going to be wearing a mask every single time, which is going to be problematic for the ears, you could purchase or make your own headbands or have little plastics in the back of your head to help reduce the friction from the ears. So if you're a female, you can make a headband with 2 buttons on the side. And when you put it over your head, you could put it above your ears. And to put on a face mask, you're going to apply it over your nose, and you could do it over the buttons or over your ears. It has to go all the way above the nose, below the mouth, and to reduce air from coming up, you're going to pinch at the nasal bridge. And because there's going to be contact with patients and clients, then you wear goggles. And so you could also put that above the buttons as well. If you don't have goggles available or a face mask that is separate, then you would wear your face mask with the shield, and the same idea applies, where you put it over your face, behind the buttons, pull it down, and pinch. To properly store any face mask, you would use a paper bag, any clean paper bag, and then you would place it as so. And so the idea is to avoid contact with any other surfaces, such as you do not want your face mask facing down if it's touching other people or in contact with other germs. The CDC recommendation is any face mask in a public setting is going to be beneficial to help reduce the spread of the coronavirus. And so it helps reduce the spread if you're symptomatic or asymptomatic, and any of these masks will do. N95s do have to be fitted in a clinical setting for it to be the most beneficial to reduce the spread. But the CDC says any mask of any type is going to be beneficial. So it is not recommended for the general public or anyone to use any kind of Sani wipes or Lysol disinfectant wipes on anything other than surfaces. So it's not meant to be used on the skin or for human consumption. Leave it for cleaning any hard surfaces, door handles, woods, any beds or keyboards to disinfect the surface.